Childhood trauma can have profound and lasting effects on an individual's personality and overall psychological well-being. The impact varies based on factors such as the type of trauma, the individual's resilience, the presence of supportive relationships, and the age at which the trauma occurred. Here are some common effects of childhood trauma on personality. Difficulty managing emotions, leading to mood swings, anxiety, or depression. Increased sensitivity to stress and difficulty calming down after being upset. Difficulty forming and maintaining healthy relationships due to trust issues or fear of abandonment. Anxious or avoidant attachment styles, leading to clinginess or emotional distance in relationships. Low self-esteem, feelings of worthlessness or pervasive guilt. A distorted self-concept, which can include viewing oneself as fundamentally flawed or unlovable. Increased risk of engaging in risky behaviors or experiencing difficulties with impulse control. Perfectionism or overachievement as a way to gain control or validation. Negative thought patterns, such as catastrophizing or expecting the worst. Difficulty with concentration, memory, or other cognitive functions. Difficulty trusting others or the world, leading to hypervigilance or paranoia. A persistent sense of insecurity or fear, even in safe environments. Difficulty feeling or expressing emotions, sometimes resulting in a sense of numbness or detachment. Suppressing emotions to avoid dealing with painful memories or feelings. In some cases, severe or prolonged trauma can contribute to the development of personality disorders, such as borderline personality disorder, BPD, or dissociative identity disorder, DID. These disorders often involve intense emotional instability, difficulties with identity, and complex interpersonal relationships. While trauma often has negative impacts, some individuals experience post-traumatic growth, developing increased resilience, empathy, or a stronger sense of purpose. These positive outcomes can emerge as individuals work through their trauma and find meaning or strength in their experiences. Childhood trauma can manifest in physical symptoms, such as chronic pain, headaches, gastrointestinal issues, or unexplained medical conditions. These somatic symptoms can be a result of the body's response to chronic stress and trauma. The cultural context can influence how trauma is perceived and addressed, affecting the individual's response and recovery process. Stigma around mental health or trauma can hinder individuals from seeking help or receiving adequate support. Trauma can shape how individuals view their future, influencing their goals, aspirations, and expectations. It can also affect how they perceive themselves in relation to society, possibly leading to feelings of alienation or a desire for social justice. The effects of childhood trauma can be mitigated with appropriate therapeutic interventions, such as trauma-focused therapy, cognitive behavioral therapy, CBT, and other forms of counseling. Additionally, support from family, friends, and community resources can play a critical role in healing and recovery.